Welcome back, guys. Today we are going to see the management of anemia. Mild anemia and moderate we manage as OPD cases. So now in OPD, take history that direct us to anemia, like dietary, bleeding, hygiene from home, any sickness, living situation, and then after that we are going to do our vitals observation. Do vital observation, TPRBP. So this one, temperature, pulse, respiration, and BP. Then we are going to do our general examination from head to toe. Now, from the head, we are going to look at the eyes, if the eyes, and then the conjunctiva, if as pallor, yellowing, and then we come to the mucous membrane of the mouth. We check the tongue, we check the gum, and then we come to the palm of the arm, the palm of the hand. If it is pale, we check for the capillary fill. If a female, mostly this one also in pregnancy, female, we check at the vagina. And then we come to the foot. We check if the sole is pale, and then the capillary fill at the toenail. So that's our general examination from head to toe. Now, we will do our laboratory test after all this examination. Do laboratory test. Number one, we are going to do MRDT, rapid malaria rapid diagnostic test, to rule out malaria, and then we are going to do the BS. Also, we are going to do CBC or HB blood grouping and cross matching to see the level of anemia. So now, if the results are back, you are going to manage according to the one, level of the haemoglobin level, 2, then you manage the cause. So if malaria, what are you going to do? You give quinine tablet to the pregnant woman, 600 milligram TDS for maybe 7 days. Then you give some paracetamol, 1 gram TDS for 3 days. This one will be the doctor's prescription. Remember, if you are writing, you need as prescribed by the doctor. Now, if other cases, you can give coartem according to kilogram body weight, and don't forget to give antipyretics in case there is fever. If there is hookworm, if there is worm infestation, you deworm. I mostly use albendazole, mebendazole in pregnancy. And then don't forget to give fever. This one, ferrous sulfate and folic. acid. Then review this person after 2 weeks to 1 month. By then you are finished managing mild cases of anemia. Now, if someone is having severe anemia, this one is in the hospital. So we could do all the other investigation we have done in mild, but now in the management, what we are going to do, we are going to admit depending. If a mother, we are going to admit in maternity, pregnant mother. If an adult, we are going to admit in medical ward. If a child, we are going to admit in PID. So we're going to admit this person, and then we are going to do all our investigation. But now, in the laboratory test, don't forget to do the RBS, random blood sugar, because most people may come with hypoglycemia. Now, when the person has low RBS, give glucose, mostly dextrose, depending on the weight, on the age. Children, dextrose 10%, older children, dextrose 25%, and then adults, you can give dextrose 50%. Now, to give blood to this person, packed cells, whole blood, this one is 10 mils per kilogram body weight. This one is 20 mils per kilogram body weight. So if whole blood is given, you need to give Lasix. Now we need to monitor vitals 2 hourly, and then you need to monitor fluid intake and output to prevent cardiac failure. And then the most important thing, you need to investigate the cause. You get the cause, and then you treat the cause. If malaria, treat malaria. If malnutrition, treat malnutrition. If worm, treat worm. If due to sickle cell, you manage sickle cell. You manage how you have the protocol for managing sickle cell. If there's other problem, you also manage it accordingly. Then advice. You need to explain to the person why the person had anemia. 2, you need to then advise on diet. Food to be eaten, well-balanced diet. And then to the pregnant women, they should rest, avoid over frequent childbearing, which means they need to use family planning, and then they should take treatment as prescribed by the doctor, mostly in antenatal. The other folic acid, pepper they give, they need to use mosquito net, and then they should deliver from the hospital. Why? Because this one is already at risk of bleeding. If not managed well, it can cause problems. So that is all how we can manage anemia. Thank you for watching, and see you in the next one.